Good morning, my lovely people. Let me start by welcoming you back to our YouTube channel, whereby we always enjoy lots of educational bangers each and every day. So, welcome back to this channel, and today we will be looking at what is chronic kidney failure. As we all know, for the better part of this month, we have been talking about kidney failure, which is one of the longest topics we have ever had and a very important one. And before I continue, if you are there and you are watching this channel for the first time, please take a second or two, click the subscription button and make sure you put the notification bell on so that whenever I upload a video like this, YouTube will automatically notify you and you will never miss any of our videos. I also appreciate the returning subscribers who have kept this channel going forward. Feel appreciated. I can't also forget those who are giving out the topics, the one we always discuss. And as I always say, if you have given your topic and it has not been discussed, don't give up. It's just a matter of time and your topic will be discussed. What is chronic kidney failure? I'm sure everybody or everyone knows what kidney failure is, because I've been discussing it in details. So what is chronic kidney failure? Chronic kidney failure is the loss of kidney function over months or years. This means that it comes over time. It takes months or years. It's not abrupt. It's not acute. So it takes some months or years for the kidneys to fail or to lose function. This means that it gives you a lot of time to sort out or treat the kidneys earlier in advance. But most of us just ignore, keep on taking painkillers until the kidney function is lost completely. So, chronic kidney failure is the loss of kidney function over months or years. In advanced stages, dangerous levels of waste and fluids can back up in your body. Remember, at a point we said that kidneys are the filtration system of the body. That means they eliminate the toxic waste products like creatinine and urea from the blood. So when they are not working, it means there is accumulation of these waste. That's why we are saying in advanced stages, dangerous levels of waste and fluids can back up in your body because they are not being eliminated. Kidneys also help in regulating the fluids in your body. If the fluids becomes too much, the kidneys responds by making someone urinate, and this helps in balancing the fluids in your body. So this condition is also called chronic kidney disease. In advanced stages, dangerous levels of waste and fluids can back up in your body. This condition is called chronic kidney disease. Your kidneys filter excess fluids and waste products from your blood. This is the main function of your kidneys, that they filter excess fluids and waste products from your blood. These waste products are typically eliminated in your urine. The creatinines, the urea, they are typically eliminated in urine or in form of urine. Let's look at the symptoms of chronic kidney failure. How can you tell that a person is having a chronic kidney failure, not an acute kidney failure? Because you can't just look somebody at a glance and assume that he or she is having chronic kidney failure. What are the symptoms you will see? What are the symptoms you will depict so that you may come to a conclusion that one is having chronic kidney failure? Symptoms of chronic kidney failure. If you are in the early stages of chronic kidney failure, you may or may not have symptoms. This means the early stages of kidney failure may be asymptomatic or may have no symptoms at all. If you are in the early stages of chronic kidney failure, you may or may not have symptoms. Some early symptoms of kidney failure can also occur with other illnesses and conditions. This means that some early symptoms of kidney failure can accompany or can occur with other illnesses and conditions. If you are in the early stages of chronic kidney failure, you may or may not have symptoms, and some early symptoms of kidney failure can also occur with other illnesses and conditions. This can make diagnosis difficulty. What does this mean? The fact that some early signs of kidney failure can accompany other conditions or can come up with other conditions or illnesses, it will be so difficult for the doctor to diagnose chronic kidney failure, because many illnesses and conditions have symptoms which resemble each other. That's why we are saying some early symptoms of kidney failure can also occur with other illnesses and conditions, and this can make diagnosis difficult. What are the early symptoms of chronic kidney failure? Early symptoms include: number 1, high blood pressure; number 2, swelling in your hands or feet. We have said that kidneys help in eliminating fluids, so when they fail, it means there will be excessive backup of fluids in the systems, and this leads to the swelling of hands or feet. Number 3, urinary tract infections. Urinary tract infections. Number 4, protein in your urine. We said that when you find proteins in the urine, it's an alarm, and it can show that you are having a problem in your kidney. So protein in your urine. And number 5, blood in urine. Let me repeat these symptoms again because it's very important. Early symptoms of chronic kidney failure include high blood pressure, swelling in your hands or feet, urinary tract infections, proteins in urine, and blood in urine. A point to note: if the damage to your kidneys gets worse, and this is very important, if the damage to your kidneys gets worse, you will eventually notice symptoms like or you will eventually notice that the symptoms are becoming more severe and severe. If the damage to your kidneys gets worse, you will eventually notice symptoms, and this also means that we have said the early stages may be asymptomatic or may not have any symptoms, but as the disease progresses, symptoms will start popping up, symptoms will start showing up. So later stages symptoms can include the following. If this disease progresses, the later stages symptoms include: number 1, difficulty in staying alert. You can't stay alert for a while. Difficulty in staying alert. Number 2, cramps and twitches. Cramps and twitches. Number 3, numbness in your limbs. Number 4, weakness. Number 5, fatigue. Number 6, bad breath. Number 7, skin that's darker or lighter than usual. Number 8, bone pain. Number 9, excessive thirst. Number 10, bleeding and bruising easily. Number 11, insomnia or lack of sleep. Number 12, urinating more or less than usual. Number 13, hiccups. Number 14, swollen feet and ankles. This is obvious because of the accumulation of fluids. Number 15, missing menstrual periods. And number 16, shortness of breath. Let me repeat these latter stage symptoms. Number 1, difficulty in staying alert. Number 2, cramps and twitches. Number 3, numbness in your limbs. Number 4, weakness. Number 5, fatigue. Number 6, bad breath. Number 7, skin that's darker or lighter than usual. Number 8, bone pain. Number 9, excessive thirst. Number 10, bleeding and bruising easily. Number 11, insomnia or lack of sleep. Number 12, urinating more or less than usual. The urination rate might go up or go down than usual. Number 13, hiccups. Number 14, swollen feet and ankles because of the accumulation of fluids in the body. Number 15, missing menstrual periods. This is specifically for ladies. And number 16, shortness of breath. This marks the end of our first video today, or video of the day. Thank you for your time. Thank you for those who are following this channel. Thank you for the subscriptions. So let's continue sharing our videos so that they may be recommended all over the world, and our channel will continue growing bigger and bigger. Have a blessed day ahead.